Okay, so I wanted to do a little talk about the things that can kill you. This is not actually very medical because if we were doing this, oh, hang on, I think our camera's not working. It has returned. Okay, so I want to do a quick talk about the things that can kill you. This is not a super medical talk because if we were doing a medical talk, the top one would just win. Organ failure is what always kills you. Um, it's actually a running joke when you're filling out death certificates that you shouldn't just write like heart failure because that's what kills everyone. Um, but organ failure and what we're talking about here, first of all, anytime we're looking at one of the other ways to kill you, it's from the context of how did it cause organ failure. And really, the organ we care about, especially in cataclysm, is the brain. So, like your heart stopping is a death sentence, but sometimes we're talking about a cyborg. So, they may not even have a functioning heart anymore. So, really, we're talking about brain death when we're talking about organ failure. And so, all of these should be seen through the lens of how does it cause brain death, right? The most standard organ failure we're going to see for most of our wound modeling is going to be like a direct headshot that destroys your brain, or a direct like chest wound to your lung or heart that causes you to be unable to breathe, which are actually under asphyxiation and or blood loss. But that's what I mean by saying at some point we're not going to model asphyxiation. We're just going to say you took a bullet, like a shotgun shot to your lungs, you die. There's not much point in calculating how many minutes you have before you like die from oxygen to your brain.
Or fighting a zombie Hulk without a helmet.
Yeah, fair. So the next most common one we're probably going to see like quickly in combat is going to be blood loss. And I'm here specifically meaning blood loss, but not like getting shot in the heart and bleeding out rapidly through that, because we're just going to mark that as death.
Basically, post-combat blood loss.
This could still be in combat. So that's where we get to the stuff we were talking about. Like if you have a severed limb, like if somebody like cuts your leg off, especially like I was saying earlier, especially above the knee where your femoral artery is at its strongest, you're going to bleed out really, really fast. So we may still model that you don't have a leg if we want to get into that and if it's not too difficult. But the main thing we're going to be modeling is that you have now functionally unstaunchable blood loss and you will die within a minute. And we're probably just going to say, huh, you're dead. Because it's not going to be a lot of fun to watch a minute of game time as zombies pour on top. Well, it might be kind of fun, actually.
Well, maybe the whole watch as you die by bleeding out.
Yeah, like that. We may integrate this to watch the last few minutes of your life because we'll have all of the pieces. It's not going to be hard to model it, and so we could have you enjoy watching your character descend into hypovolemic shock and be eaten by a horde of zombies because that's what we're all in this for. The other way you're going to see a lot of blood loss besides just having your arteries severed comes down to organ failure again, but in a different way. Like if you take a bullet wound to your liver, you're going to bleed dramatically and profusely and die pretty quickly. It's the sort of thing where it could get you to medical attention in modern life and you might survive, but even now, probably not. In a cataclysm, no, you're not going to.
So what kind of time frame would that be for a liver shot or stab or something?
I would definitely have to look that one up. The liver has a lot of blood vessels in it. It's easy to bleed out through a severe liver injury, but it can also regenerate, which is part of why, like, if it's a glancing blow to your liver, you might live. But we don't need to necessarily, like, in terms of game stuff, we don't necessarily need to have a wound that hit your liver. Like, we could do that, but I would suggest we just have a wound that hits your guts or something like that, and we track that those make you bleed internally
Vitals,
a lot.
Yeah. I think, is what we were going to call those.
Well, I'd be a little cautious with that because the type of vital does matter a little bit. Like, guts specifically would refer to, like, your liver, maybe one of your kidneys, maybe your intestines, stuff that hitting it's going to cause a lot of blood loss and a high infection risk or certainty of infection, depending. But isn't necessarily going to kill you outright like a shot to the heart would, but is going to kill you very quickly through blood loss unless you have some sort of access to medical care.
I'm just going to write brain death here because we want to remember that this is the main thing that we're talking about when we're talking about organ failure in DDA.
And then where this gets, and we already have a pretty good model for blood loss, so a lot of this is just going to be looking up some stats and fine-tuning the amount of blood loss we calculate. We also need to calculate internal bleeding, which can already be done with our current blood loss model, but you may want to have, and I love this, you may want to have a hidden container inside the body to store some blood, because there may be a situation where like you survived internal bleeding and we want to have blood spill out on the ground when you get stabbed in the stomach or something. Only if it's easy, because I can't think of too many situations where that's super useful, but I can think of a lot of situations where it's super fun. Then asphyxiation and blood loss cross over a lot like blood loss and organ failure do. So ultimately, just to back up a bit, so blood loss, what this causes is hypovolemic shock, where your heart is a pump, and when you no longer have enough fluid in your body, your heart can't pump it efficiently anymore, it no longer pumps blood to your brain, then you can't get oxygen to your brain, and then you die. So all of these are ultimately asphyxiation, which is ultimately organ failure, which is ultimately brain death. Like, it's all still the same thing, because that's the only part we actually care about. Asphyxiation, so we're going to skip over. At some point, we probably do want to make sure that the blood loss causes the asphyxiation effects, depending on how we choose to model those. But when I say asphyxiation, I don't just mean like, rich people who die doing things in their special basements. I specifically mean like the inability to oxygenate your blood. So the most...
An interesting comment I have to make about the code specifically is the character does have an oxygen stat.
Yes.
This is the stat that you use in order to swim with. However, we can definitely use this to sort of model asphyxiation in some way, for perhaps to make it slower to regenerate, for example.
So we can actually get back here to something that I've been wanting to do for ages, which is to change the word of what the current stamina stat is, which needs to be changed for a lot of reasons, because stamina is a very vague term that could mean a ton of things. So in the process of this, one of the relatively small overhauls that we should do relates to that, which is that the oxygen stat that we use for swimming should become the stamina stat. Because if you do a sprint and then dive in the water, you can't hold your breath as long because your stamina is literally your blood oxygen level. And a few other things, but we can merge them together quite safely. So if we change the word stamina to breath, it's also helpful because we can then tell that that stamina is not like your long-term
Yes, absolutely.
Yeah.
It's your short-term, sprinting.
Yeah.
Quite literally.
And we already used phrases like you're out of breath in relation to stamina, so it's not going to be a big shift for characters. It's a shorter word, and it doesn't mean anything else.
So quite literally, we're not necessarily going to overhaul this, but more change the stamina word to breath, and perhaps merge this oxygen stat that we use for breathing underwater into stamina, and make it so that when you're underwater, stamina doesn't regenerate.
Yeah. So the only caveat there is got to make sure we don't mess up fish mutants and other things where they should be able to breathe underwater. So we may wind up with some secondary second stat, but I think most likely we can probably just turn oxygen stat into breath and have it, like if something improves your oxygenation, it just allows you to regenerate stamina underwater, for example.
I also think it would be pretty easy to deal with fish mutants, especially if we're wary of it, because if you have the gills mutation, it might have the gills mutation flag, and in the function that regenerates the stamina, it checks if you're underwater, and if you're underwater, it checks if you have the gills, and if you have gills, well, you can still regenerate stamina as normal.
Yeah. So talking about asphyxiation and breath, we get into some fun stuff. I'm going to, I guess I won't bother pausing the video, but I'm going to go grab something, and I'm going to make this kind of interesting. Okay. So there's a bunch of ways that your breathing can be interrupted, and the simplest way to think of it is your airway, right? So we already model mouth encumbrance. If you're wearing a mask, like a gas mask, and you're trying to run, it's harder. If you're wearing a surgical mask, it's not harder. Don't complain to me. Then you have the airway itself, the trachea leading down to the lungs. So here's where here's where we could model that if you eat your food too quickly, you choke. No, let's not. Maybe not today. That's for another day. No, if you get kicked in the throat, that would be potentially a wound that could cause asphyxiation. There's a bunch of ways we could model that. We could model that as a permanent unremovable mouth encumbrance. And that might be how we model a lot of asphyxiation type injuries.
So this actually relates to something I worked on directly in relation to implementing limbs itself, which are limb scores. So breathing could be a score for a limb, and it be attached to the neck, the mouth, maybe a little bit of the torso to represent the fact that the lungs are there.
Yep. Well, quite a bit in the torso. So these are the physical ways you can be asphyxiated, right? So your mouth can be blocked up with something. You can have been punched in the mouth by a Hulk and left nothing but a mangled mess that you can't breathe through. You can be kicked in the throat by a ninja zombie and have your trachea collapsed. You can be shot to the heart and you're to blame, and then your lungs start to fill up with fluid. All of these are physical ways, or actually your torso starts to fill up with fluid and crushes your lungs in the case they're talking about. Now that doesn't matter because if you get shot to the heart, we're going to kill you. But you could get stabbed here and start bleeding out into your mediastinum and develop a hemothorax where your lungs get pressed up by the blood. And then again, it's going to be the same effect, just a reduce, like the same as we currently do with mouth encumbrance. You're just going to be unable to. My dog is here. She's not on screen, but she's here. Hello, Zoe. It's going to be basically the same as we do with current mouth encumbrance, where it just reduces your ability to breathe, which results in your breath not recovering as quickly. When your breath starts to get really low, there is where we do need the oxygen stat. So you shouldn't be able to asphyxiate by running out of stamina. So we do need a point where when your breath runs out, now we have a final oxygen stat, which is the asphyxiation oxygen level. So we probably do want to keep that as a separate value, or just have a hidden stamina reserve that you can never use up intentionally, but when you hit 0 stamina, you start to go negative or something like that. That would probably be the way to do it, negative stamina.
Yeah, that would be one way to make it so that it's only one stat. Now, I want to talk a little bit about mutants.
Okay.
So asphyxiation is your inability to intake oxygen. There are definitely species of frog that breathe basically through their pores in water. Now, what would that look like for a breathing stat and taking damage to perhaps your throat, and you can't breathe through your mouth anymore, but you can still perhaps absorb some oxygen through water?
Yeah. So here's where we get into some of the stuff with cataclysm mutations, which I think Kevin's concept of it, and in turn eventually mine, I've come around to his way of thinking, are not necessarily what you would assume, which is that mutations are semi-magical because they're powered by an interdimensional elder god, but they're not supposed to be super magical. So for example, the like putting in roots and photosynthesizing with plant leaves doesn't turn you into a tree that can also walk and do all the things a person can do. You still need more calories, because the reason trees can't walk is because photosynthesis doesn't make enough energy to walk around and throw things at people and shoot AK assault rifles
and make tree catapults.
Yeah. And so the same thing applies to a limited degree here. So the mutation you're talking about, I would say it would be a mutation where if your skin is wet, you can absorb oxygen independent of mouth encumbrance to a certain degree. But the reason that large organisms don't breathe that way is because our skin surface area to volume ratio is much lower than frogs. Only small, like physically small organisms can do that. There's otherwise just not enough oxygen in the atmosphere. So something like that would be a mutation that like has a role here for sure. If you're kicked in the throat and you can breathe through your skin, then your oxygen rate would fall way less quickly. It possibly would let you get medical attention in time or clear whatever it is that's in your trachea or something like that. But I don't think it would bypass this completely. Now, that's all a bit of a tangent. Ultimately, the point is you need a mutation that can let you increase your breath score independent of your breathing apparatus.
Yes, and I do also think that that kind of thing would be an interesting bonus for those who want to swim a lot. You know, if you wanted to swim and you can ingest because I can't find the right word, additional oxygen from the water, your stamina will go down a lot slower because you're breathing a lot more.
Yeah. Exactly, and then that fits with being a frog mutant because it's just super cool. I mean, that sounds like a wicked mutation. I'm down with that. I think that's independent of this, though. Ultimately, that just means that you need a mutation that has the ability to increase your breath score without using your airway. You may want that mutation to like make note of the fact that it's coming from your skin or something. If we want to get really granular, then we could track damage to your skin, and that could interfere with your breathing. But ultimately, to do enough damage to the skin to give them a problem respirating when it's already just a small portion of their respiration is probably not going to matter. So that's but that's just the physical portion of asphyxiation we're talking about anyway. The other thing to remember with all this is that the asphyxiation is really the inability to get blood to your brain. So like you asphyxiate, quote unquote, if you like go into hypovolemic shock from blood loss and can no longer pump blood to your brain. That's still hypooxygenation, and you still go exactly the same thing happens to your brain as if your lungs weren't exchanging oxygen properly or you're breathing carbon monoxide or something like that.
So we almost need a new limb that is the neck because of how dangerous it is, because of how connected it is to your brain and how much goes on in between the rest of your body and your brain.
Possibly. Hit locations might work fine there because a lot of the stuff that hits you in the head can be treated as hitting you in the neck as a slightly lower value version of all the same stuff. Like if you're hit in the head, it can interrupt your breathing. If you're hit in the neck, it can interrupt your breathing. It's a little bit harder to do it if you're hit in like a different spot. But that's why that location quality stuff we were talking about can be useful. So we could probably just call it part of the head because it's mostly the same stuff, just a little bit lower down. The only exception being stunning and things. It's hard. Well, you can stun someone by hitting them in the neck hard. So the other bit there is the inability to get oxygen through your blood. And I was going to go on somewhere with this. Where was it? Lung exchange. Oh, gas attacks and stuff also fall under asphyxiation. So if you have a smoker zombie and you're standing in a cloud of smoke, we should be tracking that you're breathing in a bunch of smoke, not just to give you a cough effect, because maybe you've got some mutation or bionic that keeps you from coughing, but also because you're now intaking less oxygen, your breath is not going to be regenerating as quickly, and potentially, depending on what kind of thing you're breathing in, it may reduce your lungs' ability to exchange oxygen into the blood. So we would track that as a long-lasting effect that reduced.
Or perhaps individual small wounds even, depending on how long you stay in smoke zombie area or noxious fumes in the mines or a boomer zombie of something like that.
That's exactly what I'm getting at, is like an acidic cloud could cause a special type of wound that limits your oxygen recovery and heals the same way as any other wound. We'd track its age. It probably can't get infected, but maybe it can. You can get a pneumonia from that kind of a scarring. And then we have infects into, it would infect into a pneumonia, and now you've got a shitty life. Sorry, survivor. So that's the other side that asphyxiation could potentially take is, I really like, for example, the idea of walking into an acidic cloud. Then you get immediate damage to your lungs. You would get scarring damage to your lungs. You would have like probably hours to days of decreased ability to breathe. When again, we're not talking about the wound that would kill you outright here, because that's no fun. I mean, it could be fun depending on how you got into that situation, but like Dwarf Fortress fun with the exclamation marks. But like we're still talking here about I walked into a cloud that wasn't enough to outright kill me, but definitely left me wishing I'd been wearing my gas mask. So then you have reduced oxygenation for several days, and that was the wound that could potentially progress to the point that you get organ failure because you can't oxygenate your brain, even though you have no cuts on your body and haven't taken any impacts and aren't bleeding.
So, side note, actually, for the time frames, I think this is a good time to consider what Kevin has been talking about for a long time, which is adding a new trait to everybody as a default trait that is your accelerated healing.
Okay.
That puts us to where we are now.
Yeah.
And when we design wounds, the healing rate, the recovery rate is going to be listed as how long it would take to heal a normal human being, in modern times, maybe with minimal treatment, and then treatment can adjust it, and then infection can adjust it again.
Yeah, and your healing trait. So then we're talking about blob regeneration being a default trait that you can potentially purify out, which is fun. So that's a little bit tricky because it's so variable. I'm sure we could work that in. What we may want to do when we're working that in is to do what we're always accused of not doing, and actually have the blob mutation portion take into account like trying to make sure that you can recover from some common injuries in a reasonable time frame and are not left completely out of the fight by them. So for example, walking into a mild acid cloud would, if it didn't kill you, would probably leave you in the hospital for weeks, and would probably kill you. But we could have it leave you out of the fight for like days to a week or two, assuming you don't get a pneumonia and all of that extra stuff. But if it's just that wound, because days of recovery, and even in game like a week of recovery, remembering that as the wound ages, it becomes less serious. So towards the end, you're just coughing a little bit and can't run. Well, that's the kind of recovery that feels kind of good in game. Like you're out of the fight for a bit, you know you did something significantly bad, but you also get that feeling of like, yeah, man, like I was out for a week, but then I got back up and I am back out as a survivor. So that's where I would target the blob healing thing, is on the short side of realistic. Like that's too fast really to recover from walking into aerosolized acid. But it's not like oh yeah, sure. Like it does feel like a recovery. Like before you change the healing times, we were facing a really severe problem, which is
which is you recover in an hour of you're at 0 HP almost, and you take an hour nap, and then now you're suddenly healed again.
And there was no point in healing items, and you're effectively Wolverine all the time. And then when we changed it the other way after the salt settled down, pretty much everybody was recognizing, like, okay, no, this is fine. Like, I can use a bandage and I can recover most of my function in a day, but you actually have to take wounds seriously. And I think that's the target point we're aiming for. Our current wound time is not so
That would
fast.
be after the blob regeneration is implemented. A lot of people, the reason I brought up the blob regeneration is a lot of people still consider our healing rate as pretty fast.
Yeah.
So they do imperceptive healer as, oh, that makes everything feel normal again.
Yeah.
Well, I kind of want to make it so that imperceptive healer is actually terrible, and our blob healing and then like normal healing is maybe slightly on the high end of this is you recovered pretty quickly, but it's still realistic. And then like the what's the next one? Like weak healing, I think it was.
I can't remember.
It's like, oh well, it's kind of like a realistic life. Like, well, it took me a little while, like an 80-year-old trying to recover from broken bone or something like that, or an imperceptive healer, which is like, wow, this is almost amputation level bad.
Yeah. And I mean, I think it should be a fun challenge trait, so I would like to recover that, so that it's not something... It should always be something you don't pick because you like the game balance and it feels more real. You should be picking it, because you want that challenge of having imperceptive healer. So then you would start with default on, like, post-cataclysm healing. I don't want to call it blob healing because I don't want the blob to be in-game. But
we can pick a better name. It's just...
Apocalypse healing or something like that. But... if we make that a default on trait, then all of this is going to change wounds and recovery time. So all we really need to do is, like, if you think about all of the cuts and bruises you get in your daily life, if you get cut doing the dishes and it's a relatively deep cut that doesn't need stitches but does need a Band-Aid, you're going to have an annoying and painful cut for like several days. And so that would be real healing. Now also, after a couple days, the cut is just annoying, and so that's where the ages into and stuff like that is important. First, you have an active cut that needs a bandage, then you have like a sore, slightly reddened cut that is mostly healed, and then finally you have a faint white line, and then finally it's gone. So in game, each of those steps by default could probably be like less, for something like that, a superficial cut could probably be less than a day, assuming you put like a bandage on it and stuff like that. So by the end of the day, your cut is already like closed, and just slightly painful, and then by the next day it's gone, kind of thing. That's fast, but it's not so fast that you're going to look at it and be like, this is ridiculous, I'm an X-Man.
Yeah, and we definitely want a way to go beyond the post-cataclysm healing. Maybe we could call it Colluptic to...
oh, yes, I do like that one.
Or is it Colluptic?
I don't know, but I'd say Colluptic.
Either way, we could call it that, and then we are going to have... We do have two or three levels of higher level of healing. Fast healing. I think it's just called very fast healing, and then regeneration. Mm-hmm. So your deep cut in a dish with regeneration might heal in minutes because it's not really that severe of an issue. And the whole point of regeneration is, well, we're using a ton of calories in order to do all of this, and we need to constantly eat. And
comes with its downsides. It strikes me that we really missed the boat. Not that Colluptic psychosis is not great, but we could have called that Colluptomania, and we didn't.
Well,
So
we could just make a pull request.
I'm going to just apologize to everybody out there. I've never said it out loud, so it never occurred to me before. Anyway, I would like to get into infection, but I think that's going to be another big topic, so we should probably take a short break and then come back and discuss specifically how infection can kill you, because we basically covered blood loss and asphyxiation. Blood loss, we wanted to talk a bit about mangling first.
Oh, yes.
So
yes, definitely.
So that's the other thing. We talked about mangling and how mangling can destroy your limb and its function, and effectively turns like multiple small wounds into a large, more dangerous wound. Effectively, I don't know if it's going to functionally do that. We can figure out the nitty gritty. But the other thing that mangling should generally represent is like you're now bleeding a lot more out of that wound. So we're talking about maybe a number of small cuts, but as they've added on to each other, they like become worse. And start bleeding more and more. It means that mangling's primary way of killing you is still going to be blood loss or later infection if you manage to staunch the blood flow. There's also a whole, like, mangling as a mechanic is something we may need to get deeper into, because effectively I think what we're looking at is when you hit a certain mangle threshold, we probably apply a new wound to the limb that is mangled.
Maybe. So, earlier we were discussing the 3 different objects that I was considering, and the limb wounds object is our total list of all of the wounds on that particular limb.
Mm-hmm.
So what we could do is whenever we're checking, maybe whenever we add a new limb, we're deciding, okay, is this limb mangled yet?
Oh, yeah.
And what does that mangled effect specifically have on it?
Yeah.
And does that have a sort of sundering quality to your armor of your flesh?
Yeah.
You know, does that make further wounds even worse with more bleeding and more pain? Because all of the wounds that are on there, no matter what age they are, will have some effects on it, and all of those effects are cumulative.
Yeah. I think this is basically what you're saying, but I'm just going to rephrase it. Correct me if I'm wrong. Basically what I'm picturing then is when a new wound is applied, in addition to the damage and location and stuff we talked about earlier, we also look at the current mangle score, which effectively like raises the threshold on your wound and makes it more serious. Not just a more serious type of the same wound, so you get slashed with zombie claws and all of a sudden you have a giant gaping hole from the zombie claws, but more that we see that the mangle score is already at 30, and so now this zombie claw attack instead transforms to a mangled arm.
Right, and you could perhaps add other effects that you wouldn't normally get from your first claw attack, like, oh, this is past the layers of skin, so it's actually gouging into your muscle, which is reducing your arm function.
Yeah, so mangled in this case is basically exactly like you're saying. It's a durability score for your arm. And just like item durability, at a certain point, it starts losing some function and changing how your arm works. We also talked between our recording sessions, and I think it's worth putting on here for posterity, about mangling and how it affects like prosthetics, whether they're bionic prosthetics or like a peg leg. And I like the example of a peg leg because I think it's one of those things that pares it down to the simplest elements, and then we can re-add things in. So let's say you had your leg cut off, probably because of infection, because it was cut off in a fight, you're dead. Now you have a peg leg, which is awesome. It's not quite as good as your old leg, but, you know, suck it up. It's an apocalypse. Now, an attack against your peg leg can inflict wounds the same way anything can inflict wounds, but your peg leg is only susceptible to literally, like, you can have a slash wound on your peg leg, but aside from the fact that it's not going to heal, nobody cares. Like, okay, it was really nice polished birch from a table that I looted in a mansion, but fine. But the mangle score is what's going to be relevant because it effectively returns us to our old limb model, which functions very much like a peg leg, which is that, you know, that slash doesn't matter, that bash doesn't matter, but as I add up more and more damage, my peg leg's durability is dropping, and that's calculated with the mangle score, and when it hits the value of whatever your limb's durability is, this hardwood birch is great, that's why I got it from a mansion, but at some point, it's going to splinter and crack, and until that point, it functions just fine. Like, a really scratched up birch peg leg is just as good as any other peg leg until the point that it like cracks underneath your weight and can no longer support you.
And when we move on from a peg leg to something a little bit more advanced, like a bionic leg, you may want to actually repair the leg and have the ability to repair the leg because it's not made of wood, and wood is basically impossible to repair. You can use a repair kit of some kind to to remove specific wounds. And this is a lot like, I'm thinking a lot like the engine, what's it called?
Engine fault system.
The engine fault system,
Yeah,
except
great.
it's a part of your body. I may not necessarily worry about, okay, we'll remove the limb and then it turns into an item. No. It's going to be part of the medical system. It's just going to be a matter of, I need an electronic circuit and a soldering iron to repair this wound that has messed up the hydraulic system on my leg, making its function nearly zero.
I mean, I have to admit, a part of me would love it if you could have to remove your limb so that if your base is attacked while you're repairing your bionic leg, you have to either use your broken bionic leg or attach a peg leg. But I think mostly that's just going to be unnecessary extra key presses rather than emergent gameplay. Yeah, I think that covers it. And then, the other point related to that was with bionic limbs. Then we essentially say a bionic limb is a peg leg, but now we're going to add back in types of wounds it can have. So your bionic limb can have its motors damaged, or it can have its joint lock up, or something like that from an injury. But functionally, on the ultimate level, it's inheriting not from a flesh limb, but from a peg leg, because it's ultimately just a really advanced peg leg.
And weirdly enough, I'm considering the tables that we were talking about earlier. Is that going to be mostly per limb, or are we going to consider a much more generic table and in the code consider what kind of attacks a limb can take, like a concussion to the head, or specifically damaging your mobility by injuring your foot?
That's a question we've asked so many times, and I still don't know what the best answer is. I think in terms of looking on other games that use nested inheritance of body parts and stuff, Dwarf Fortress being the classic example, we have the same problem that they do, which is that our body plan can change. So having to make a separate wound table for a tentacle mutation or a spider limb or a wing or something like that is a lot to ask. We may want to see if we can do this with a generalized wound type table, and then the limb still defines what special attacks can be done against it, but it pulls a general wound type, like a slash wound to your chest. If it's sufficiently damaging, we would then say, that slash wound went through your ribs and now you have a sucking chest wound. But a sucking chest wound wouldn't be on the table. It would just be a high damage slash wound.
So what if we use the limb subtype features that we have, this is an arm, this is a leg, this is a hand, these are eyes, and we use meta traits to consider this arm isn't bony, so it can't have broken bones from bludgeoning damage, or this eye has nictitating membranes, so it's slight resistance to slashing damage.
I think that's that's the way to do it, and that relates back to how you were saying we can just give these things a breathing pathway flag that says that these things can have attacks that decrease your ability to breathe when they're hit. Similarly, then we would say, okay, well, now you've got the multiple tracheas in your arms trait, which gives them all the breathe trait, but also means that damage to one of your breathing tubes doesn't cause as big an effect or something. Doing that through flags that determine which generic wound types anything can fit would be pretty good. Then the torso would have flags contains lungs.
Something like that. I want to add on to that the breathing thing would be as a limb score, and maybe that's a meta trait, or there is a more general wound maybe past a certain damage / cross section threshold, where it's okay, all of the scores of this limb are reduced by a certain amount because it is just that damaged.
Mangled. Yeah. I think I guess in this case there's possibly two different things. One is the sort of discussion of the anatomy of the limb and what parts it has that you can potentially hit with a wound, which is where we put lung and heart and bone and muscle and nerve. And then there's and in that spot we might have airway, right? Which is where we describe your mouth and trachea. And we may, for airway, may need the limb to have more of a breathability score because, well, we can see. I would suggest that we just put airway in as a body part, and then your wounds potentially reduce your overall breathing score if your airway gets damaged. But it's tough to say what the easiest way to do it would be.
Well, it's definitely something we can consider some more. I think now is a good time to take a break, and we'll rejoin you guys soon.
Yes.